Sir, what is the core of plumbum met and the pathology of it?
Plumbum met is the remedy which is from syphilitic miasm basically. So plumbum met, whenever we used to consider, we have to take into consider the main action, the neurological action of the plumbum met. Acts at the neuromuscular level. Most important thing one should not forget is the extensor paralysis. That is more important. Extensor paralysis always gives you the core of plumbum met. So there is a wrist drop. You can get the wrist like this. This is a wrist drop. You get over there, or a foot drop is there. The foots are falling down, and that is also that immediately you can catch, yes, this is extensor paralysis. And if it is extensor paralysis, you must think about the first, the plumbum met. Very important remedy, very specific action on the extensors where the paralysis is there. Here there are many features. Tabes dorsalis, the plumbum met is there. That is the quaternary syphilis, where the tabes dorsalis paralytic condition happens and patient dies because of it. The plumbum comes into the role. Plumbum, there is one word, that is the degeneration. Degeneration of the spinal nerves, the anterior as well as the posterior spinal nerves, where degeneration used to get or find. The word which is used in the materia medica is the sclerosis, and meaning of the sclerosis is always the degeneration, and this degeneration you can get in plumbum. Infantile paralysis, very important remedy for the plumbum met is very important remedy for that. Poliomyelitis, specifically anterior poliomyelitis, again a remedy for the same condition. So plumbum has a very specific action, along with uric acid diathesis, along with typical constipation, the ball-like stools which are very strongly present over there. A blue line in the gums, that is the plumbum poisoning, where you can get that is another indication where you can think about the plumbum met. So plumbum is a very deep acting remedy. And this defecting remedy one has to take into consideration whenever extensor paralysis you catch in the patient. So extensor paralysis is the keynote. Infantile paralysis, poliomyelitis, spinal sclerosis, multiple sclerosis. See, all the pathologies are there, and all those pathologies are destructive pathologies. And because of destructive pathologies, it is one of the important remedy for the all sclerotic conditions. So towards sclerosis with extensor paralysis, with typical constipation and uric acid diathesis, one must think about the plumbum metallicum. Is it okay?
Yes.